Hi everyone, and welcome to another episode of The More You Know. This month we're going to tackle the topic of heart disease. And so it's a term that I think we hear oftentimes, but I thought it would be a good way to start out by actually defining what it is, what are the diseases that it causes, and what are some of the risk factors for developing heart disease. So heart disease actually includes several different medical diagnoses. The most common one is coronary artery disease. So coronary arteries are the arteries that supply blood to our heart muscle. And just like every other muscle in the body, the heart needs good supply of fresh oxygenated blood in order to work properly. And so when blood flow to the heart gets blocked by things like cholesterol and plaques, it doesn't give good blood flow and nutrition to the heart, which means that the heart muscle is not able to work the way it's supposed to. Now, when the heart muscle starts to have struggle working, you're at a higher risk for things like heart disease, for irregular heartbeats, and things like heart failure. Those are the main ones. So heart disease is actually considered to be a silent killer. And what does that mean? It means that people typically don't have any symptoms at all before they have their first cardiac event or their first hospitalization due to heart disease. As a matter of fact, I found this staggering statistic that most of the time you have no symptoms before your first heart attack, you're completely symptom-free, and up to 36% of first-time heart attacks cause death. And that's according to the Journal of the American Medical Association. So what are the risk factors for developing heart disease? Well, they are high blood pressure, high cholesterol, smoking, having diabetes, being overweight, your diet, which we'll talk about a lot in week 4, physical inactivity, and excessive alcohol use. So the good news is that all of these risk factors are considered to be modifiable, meaning that they're choices that we make every day that can either increase our risk or decrease our risk. And really we have the ability to make those choices, and we're going to help you figure out how to make some of those good healthy choices in the next couple of weeks. The one thing I do want to point out is that by increasing your physical activity, you're able to tackle 4 out of the 8 modifiable risk factors. But with exercise, you're going to be able to lower your blood pressure, lower your cholesterol, help manage your weight, and tackle physical inactivity. Okay, so 4 out of the 8 risk factors of heart disease are going to be helped just by being a little bit more physically active. So next week, we'll take a little bit of a deeper dive into how cardiac exercise or how endurance training helps prevent heart disease.